So I'm always interested in study and adding new things to my backpack of wonderful education and stuff. So I've already got qualifications in a lot of different areas: health and social studies, psychology, sociology, counsellor. I'm a qualified counsellor, law even, the English judicial system and criminal law. There's a lot of different things I've studied in. And what I'm looking at the moment is EMDR. This is eye movement desensitization and reprocessing therapy. And it's primarily recommended for individuals struggling to process traumatic or distressing memories, and it's recommended by the NHS. EMDR is highly endorsed treatment for post-traumatic stress disorder, PTSD, and trauma stemming from single incidents, accidents, assaults, or prolonged childhood or adult experiences. It's clinically recommended for individuals presenting with post-traumatic stress disorder, often considered a gold standard first-line treatment for PTSD. Trauma and abuse, complex PTSD, childhood trauma, sexual abuse, and severe medical or physical trauma. Unresolved grief, complicated grief or persistent emotional disruption following loss. Phobias and anxiety, panic attacks, specific phobias, and severe performance or social anxiety. Stuck or treatment-resistant patterns, those who feel an emotional memory disconnect, like example, I know I'm safe, but I feel scared, experience intrusive flashbacks, or haven't found success with traditional talking therapies, like CBT, cognitive behavioural therapy. The considerations and suitability. While highly effective, EMDR involves intense emotional processing and is not immediately appropriate for everyone. Individuals experiencing active psychosis or severe dissociation may require stabilization and grounding work before beginning this treatment. You can get referred by the NHS, that's the primary route, or visit a private practice, somebody who specialises in EMDR therapy. So what is it? EMDR is eye movement desensitization and reprocessing. It's a structured psychotherapy that helps people heal from trauma and distressing life events. Unlike traditional talk therapy, EMDR does not require recounting traumatic details. Instead, it uses side-to-side eye movements or other stimulation while recalling distress to help the brain naturally reprocess and store the memory. How it works. The therapy is based on the idea that traumatic memories can become stuck in the brain and nervous system, leading to emotional and psychological difficulties. It involves 8 phases designed to release these emotional blockages. So we have bilateral stimulation while focusing on a specific traumatic memory and its associated negative beliefs or bodily sensations. You track your therapist's moving finger, following a light bar, for example, or listen to audio tones. This dual attention helps desensitize the distress. Reprocessing. Over multiple sets of eye movements, the brain connects fragmented traumatic memories with more adaptive, positive information. Reframing. The goal is to replace negative self-beliefs, for example, I'm unsafe, it was my fault, with healthy positive beliefs. I am safe now. I survived. What does it treat? While it is a global gold standard treatment for post-traumatic stress disorder and complex PTSD, it is also effectively used to address a variety of other mental health issues, including anxiety and panic disorders, phobias and depression, chronic stress and grief, and other disruptive life experiences. It's unique because it helps individuals move past traumatic events without the need for prolonged exposure or talking extensively about the details of what happened. The repetitive bilateral stimulation is thought to mirror the memory consolidation brain activity that happens during REM sleep, rapid eye movement, allowing the nervous system to heal itself naturally. So what's the evidence that this works? Well, the primary evidence that eye movement desensitization and reprocessing works comes from extensive clinical trials and meta-analysis demonstrating its efficacy in treating trauma and post-traumatic stress disorder, PTSD. A robust body of research, including numerous randomized controlled trials, supports the effectiveness of EMDR. Here's a breakdown of the evidence supporting it. PTSD symptom reduction. Major health organizations, including the American Psychological Association and the US Veterans Affairs, list EMDR as an evidence-based top-tier recommended treatment for PTSD. Studies indicate that many individuals experience significant symptom reduction or loss of their PTSD diagnosis within a few months. The speed of treatment. Several studies suggest EMDR can alleviate trauma symptoms faster than traditional trauma-focused psychotherapies, sometimes requiring fewer sessions to achieve the same results. Bilateral stimulation. The hallmark of EMDR is bilateral stimulation, typically side-to-side eye movements. Research indicates that recalling distressing memories while tracking these movements reduces the emotional intensity and vividness of the traumatic memories. Beyond PTSD, while best known for trauma, clinical trials have shown preliminary evidence that EMDR can be effective for a range of other conditions, including depression, anxiety, obsessive-compulsive disorder, and substance use disorders. While there is a strong empirical support for the overall treatment model, the specific role of the eye movement remains a topic of scientific debate, with some researchers suggesting the cognitive restructuring and exposure components of the therapy are the primary drivers of improvement. So have you heard of this therapy before? Is it new to you? Do you suffer PTSD, severe anxiety, or anything ongoing from childhood or adult experiences? Is this something you would think about trying or have tried? Let us know. cafesoulpod@gmail.com. Now I'm off to find a course for EMDR.